All right, guys, how are you? Can everybody hear me? Okay, perfect. Okay, can you hear me now? Okay, can you hear me now? Okay, good. And I'm going to present my screen. Because I can hear myself on. Hold on a second. Okay, hold on. I'm going to share my screen with you, okay? Okay, good. All right, so what I was saying is health promotion and maintenance is a huge, huge deal. Miss Catherine, can you hear me now? Miss Catherine Jones, can you hear me? Everybody should be able to. All right, just give it a second. Okay, Miss Catherine, can you hear me? Okay, perfect. Good. Okay. Hold on a second. All right, so as I was saying, health promotion and maintenance is a big thing. I've had 3 students this week pass the NCLEX, right? So make sure that you guys are looking at make sure for a fact you're looking at your NCSBN test plan. And I know that you guys got it by now, right? You guys are looking at that test plan and you know for a fact how important it is. So one of the things that the test plan had was the fact that it mentioned the health assessment. So that's what we're going to go over today to kind of finalize things. I sent you guys this worksheet. Let me know if you got it. You can type it in the chat if you got it, if you have received it. And you're going to file this. You're going to make sure that you file this in your health promotion and maintenance section of your binder, right? All right, how is that? Is that better? All right, guys, let's go. Let's do it. I emailed them to you. Check your email. I emailed it to you. All right, guys, can you hear me now? All right, guys, can you hear me now? And you should be able to, okay, and you should be able to see the screen. Is the screen still blurry? And can you guys see the screen okay? Okay. All right, so follow along with me with your worksheet, okay? Okay, good. Everybody got it. All right, guys, let's rock. Trying to wait for one more student, but it's okay. All right. So you're gonna have to use your screen. For some reason, it's not as clear, but use the sheet that I sent you guys. Use your own. I emailed it to you. Use your worksheet, but you should be able to follow along. I don't know why a StreamYard is so blurry, but this is the portal that we have to use, so we'll work it out. It'll get better as it goes. All right. So if everyone has their head to toe assessment, let's rock. All right. Okay, so health promotion and maintenance. I want you guys to take a look at where it says where it's head to toe. All right. So head to toe assessment is huge during the NCLEX. As a nurse, they want you to be a safe first year nurse. So let's go through some steps that we have to take to kind of like make sure that they understand that, hey, I'm a safe nurse. All right. All right, so the first thing you want to do is look at your head to toe, step by step. The first thing you want to do is wash your hands. What do you guys feel about that? Hand washing. Do you guys think that that's going to be a big deal on the board? You think this is going to be a big deal? And tell me why. Why do you think this is going to be a big deal on the board? All right, guys, can you hear me now? Why do you think hand washing is the first thing that we need to do before we even go near a patient? Why do you think hand washing is the first thing that we need to do before we even go? Anyone want to share why? Because of its safety and infection control. So for Kiwi is some things that we use like to kind of remember what's the first steps of, what's the first thing I need to do before I even touch a patient and in between patients. So for my head to toe assessment, step by step, I knock, I introduce, I wash my hands, and I identify. It's called Kiwi. All right. I knock, I introduce, I wash my hands, I identify. It's Kiwi. Okay. That's number one. And then I verify my patient. Is my patient alert and oriented? Is my patient alert and oriented? So if there's something like, let's say for instance, let's just say for instance, I walk into a room and it's a stroke patient, or it's a patient, a patient that is diagnosed with a stroke, or they're trying to figure out if this patient is having a stroke. The simplest thing to do is say, okay, head to toe, verify patients alert and oriented. I'll go in the room and I'll say, hello, sir. And if he says hi, he's alert and oriented. Am I correct? And then I get into, can you tell me your name? Do you know today's date? Do you know where you are? That's when I ask them, do you know where you are? But for verifying the patient is alert and oriented, you walk in the room and you say, hey, hi, how are you today? Hello, sir. If they say hello or the patient says hi, that's alert and oriented. So that's huge to be able to understand the difference, alert and oriented. And then you want to make sure that you're doing your vitals. All right. So you have your blood pressure, you have your pulse, you have your respiratory rate, you have the weight, you have your O2, and you have your temperature. So taking someone's weight is very, very important. So don't forget that blood pressure, pulse, respiratory rate, The actual weight of that patient, sometimes they may give you that in kilograms, so write that down. It may be in kilograms. O2, that is your O2 saturation. That's when you put on the pulse ox for the patient. And then the temperature. The temperature, remember, you may have to have that in Celsius. You may have to convert that in Celsius. Okay? So just keep that in mind. All right, so let's talk about the mood, affect, hygiene, seasonal wardrobe, mobility aid, medical aid. So we're looking at this patient, just overall appearance, right? I'm looking at this patient. How is the patient's mood? Sometimes they'll have patient is anxious, patient is calm, patient is age appropriate, patient, you know, they want, you have to know the mood of the patient. It's just something that guides the care. Sometimes a patient may have a flat affect. All right. Hygiene. Is the patient cleaning? Is the patient clean? A seasonal wardrobe. Is the patient dressed appropriately for the weather? Mobility aids and medical aids. Always look for mobility aids, because is this patient walking with a walker? Does this patient require a walker or a wheelchair before you get the patient out of bed? That's huge. Okay. Now, memory test lists 3 words. You want to make sure that you give your patient 3 easy words like apple, pencil, dog. This is going to help with the short-term memory. So a memory test, apple, pencil, dog. Immediate memory, repeat right after me. So you're trying to test immediate memory. And for recent memory, wait 10 minutes. And then remote memory, ask patient about an event that happened years ago. So an event, this is the remote memory is the one that I always get an answer to, because for some reason we remember things that have happened a while ago. But if you ask that patient those 3 words, the apple, pencil, and dog, 10 minutes, they're not going to remember those words. So that's a test that I always fail. You know, if you ask me, so if I ask a patient, I just want you to remember these words: apple, pencil, dog. Okay, now what words did I give you? Of course, me being Katrina, I'm going to say apple, pencil, dog, like you just said it. Okay. Then the nurse practitioner or the practitioner will continue with their health assessment. And then toward the end, they'll ask me, oh, Katrina, can you mention those words? Can you tell me those words I gave you? That's it. I have no idea. You know what I mean? No idea. Completely clueless. So immediate memory, recent memory, and remote memory. They're very important. All right. Especially as nurses. So as a first year nurse, this is not, it's something that you have to, you know, be very aware of. All right, so let's move on to the next section. And I hope you guys got your worksheet. I hope you guys were emailed your worksheet. And I think the NCLEX is approving a lot of people for nursing license, guys. So just keep doing what you're doing. Don't get discouraged. All right. So back to head to toe. All right. Very good. So that's the beginning. Now, while assessing every part of the body, verbalize that you're also notating skin for texture, moisture, temperature, and hair distribution. That should be hair distribution. Why is texture, moisture, temperature, and hair distribution important? Well, you have patients who have peripheral vascular disease. Mm-hmm. And you have to be able to like put two and two together. This patient, let's say for instance, the first time this patient has ever even, stepped foot in any type of healthcare facility, you may be the first to point out, okay, this patient, it's the patient is very moist, very red, or you'll say very dry and almost a brownish purple tint, no hair. So that will, based off your assessment, the doctor can also say, yeah, confirm that this patient may be suffering from PVD or some type of issues with their lower limbs. So it is very important for us to annotate texture, moisture, temperature, and hair distribution. So make sure you underline hair distribution. So let's talk about the scalp and hair. For the scalp and hair, you want to check for lesions, abrasions, infestations, hair distribution, and texture. So you're looking at the scalp. So the first thing you want to do, you want to start at the head. Look at the scalp. The head, there's a temporal pulse and external maxillary pulse. There's two pulses. There's a temporal, there's an external maxillary. Now this can become very important, especially if you're doing a neurological assessment, and especially if you just got this patient and you don't know anything about the patient. You always want to check your pulses because it gives you an idea about your cardiovascular status. All right. So temporal pulses and external maxillary bilateral. The face, cranial nerve test, cranial nerves. We went over cranial nerves last week. Cranial nerves, cotton ball across forehead and cheeks. Bite down while feeling temporal and jawline. So that's the cranial nerve. All right. Cranial nerve 7 is smile, frown, puff out cheeks. Okay. Cranial nerve 7. That is like for me, if I am testing cranial nerve 7, if the patient is suspected of having a stroke or the patient had a stroke in the past, I can tell what weakness is prevalent or is evident. I'll tell the patient to smile, and I'll count. If I can count more teeth on one side of the face than the other, I know the other is the side that's affected. So cranial nerve 7, smile, frown, puff out cheeks. That's very important. And then you have your eyes. So check out the eyes. Okay. I'm going to try to make it a little bigger. And remember, you guys have this also. You have the worksheet. Oh, it does. Okay. All right. So the eyes. Symmetry. That's number 1. Symmetry. Color of the sclera, because remember, you have patients who have jaundice. Defect, inflammation. All right. And then, of course, you have your perla. Pupils equal, round, reactive to light, and accommodation. So perla. Pupils are equal, round, reactive to light, and they accommodate. That is huge, guys, especially if you're working with a stroke patient. So with the patient looking into the distance, you want to shine the pen light from the side. So you want to tell the patient, look at the wall, because the pupils will dilate. And when I put that pen light to the pupil, it will constrict. So pupils equal, round, reactive to light, and they accommodate. So the best way to do it is to try it out today on a family member if you have a pen light. Okay, ophthalmoscope. That's for red light reflex. So you want to shine light directly into the patient's eye. That's if you have that scope. You want to shine it directly into the patient's eye. That red light reflex should be there. So let me tell you why this is important. The red light reflex, because you'll have a lot of kids that have these issues, these neurological issues, or they have issues with their eyes. So this is something that you just don't want to take advantage of or take for granted when you're working with a pediatric population, because this is mainly where you find this issue, the lack of or an absent red light reflex. And sometimes they say it's cancer. So that red light reflex, that is us, that is a nurse, first year nurse. We are responsible for knowing that if I have this scope, if I shine it directly into the patient's eye, I should see a red light reflex. So remember back in the day when we had the cameras, all of our eyeballs would be red when we got them developed. So this scope will essentially show you that red light reflex, and it is absolutely needed. If it's not there, you have to report it. So I want you guys to make sure you underline that. So cranial nerve 2 is a Snellen chart. So you have to have that Snellen chart 20 feet away. Read the smallest line while one eye is closed. Repeat backwards and repeat opposite eye. So all of that to test cranial nerve 2. And then our favorite thing in the world to discuss. I'm going to make it bigger. Favorite thing, cranial nerve 3, 4, and 6 test. So this is the 6 cardinal fields of gaze. All right. So what do? I get my pen light and I go to this area. I'll just tell the patient to follow my pen light. Okay. I'll go up. I'll go lateral. I'll go down. I'll go up. I'll go lateral. I'll go down. So the 6 cardinal fields of gaze that will test cranial nerve 3, 4, and 6. You want to pull down the conjunctival now. Check for color. Check for discharge. All right. This is where that pink eye comes into play, or sometimes when our patient is just very dry. For the nose, patient tilts the head backwards and you're looking at the nose. You're looking for symmetry. You want to put the pen light in the nares. You're looking for discharge. You're looking for lesions. You're looking for redness. You're looking for inflammation. And to test cranial nerve 1, patient closes eyes and IDs a scent. So identifies a scent. So you can have lemon, mint, coffee. You want to test that olfactory nerve, cranial nerve 1. Mouth. Check for cracked lips, ulcers in the mouth, lesions, dental care. So while you're there, you're going to go ahead and open the mouth. Cranial nerve 9 and 10. Patient says, ah, with tongue out, shines pen light into the mouth. Observing uvula. Patient swallow water and observes uvula from the outside. So that's cranial nerve 9 and 10. So when our patients come to the hospital and we're trying to rule out stroke, but the patient, there's no definitive evidence or no diagnostic test that says that the patient has a stroke, we do a swallow eval at the bedside. So we're testing cranial nerve 9 and 10 with the swallow eval. So if that patient can swallow that water, and we're looking outside the neck to see if we can, this patient is definitely swallowing the water and the patient isn't coughing or the patient doesn't seem uncomfortable, they have passed the swallow study at the bedside. All right, you guys understand that? So cranial nerve 9 and 10, it just takes a little small amount of water. So if you guys take a drink, I don't know if you guys have a drink in front of you. I do. I have my coffee in front of me. I'm going to take a drink. I'm gonna feel, put my hand on my neck and swallow. You see, you can feel it. I'm not coughing. I'm not uncomfortable. Cranial 9 and 10 are intact. Cranial nerve 9 and 10 are intact. It's as simple as that. Okay. And then you have your cranial nerve 12. Tell the patient stick out their tongue completely. Examine the midline of the tongue. Patient repeat, light, tight, dynamite. Okay. It's cranial nerve 12. Now, the ears. External maxillary pulse. So the patient should have a maxillary pulse. You can put your fingers there. You can do it bilaterally. You can't measure a carotid bilaterally, but you can do the external maxillary pulse. Check for discharge. You're checking for lesions in the ear. And cranial nerve 8 tests. All right. Patient will cover one ear. And I'll go behind the patient and I'll whisper ABC. So I'll tell the patient, cover your right ear. I'm going to go behind the patient, right ear, ABC. Then I'll do the left ear, 1, 2, 3. I just need to know that the patient can hear. It's a whisper test. So underline that. And then you have your carotid pulse. Carotid pulse. You guys know that you're supposed to assess the carotid one at a time. I want you guys to write that down. Carotid one at a time. Outline trachea and sternocleidoid mastoid. So outline the trachea, sternocleidoid mastoid to determine if trachea is midline. So you can feel now on your neck if your trachea is midline. You should feel it. And you're also looking for thyroid enlargement. So for this thyroid enlargement, think of is it non-Hodgkin lymphoma and hyperthyroidism when you get that goiter. And for the neck, you want to test the range of motion. Does the patient have full range of motion in the neck? And then you want to put the patient at a patient lying supine at a 45-degree angle. Put the patient at a 45-degree angle and tell the patient to turn head to one side. You're looking with your pen light for a jugular vein distension. You can see this in patients who have CHF. And turgor, the skin turgor at the clavicle. So if you pinch the skin at the clavicle and it tints, that's what it's called, tinting. If it just stays, this patient is dehydrated. Okay, if it makes a tint, if the skin just sticks to itself, this patient is most likely dehydrated. So skin turgor. Remember, tinting is the complication. That the tinting is the abnormal. And then we have our wonderful lymph nodes. So lymph nodes. So you have to know your lymph nodes. All right. And I know that they're like, oh, whatever. Okay. It's not just for the head to toe assessment. What if you have a patient who is very sick? What if you have to give medications and you're noticing that this patient is lymph nodes becoming large? So as nurses, guys, nurses, LPN, we have to know our assessment. So these are your lymph nodes here. You have the preauricular, postauricular. You have your occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical, supraclavicular, and infraclavicular. So these are your lymph nodes. So I normally start here. Make it bigger. When I'm with the patient, I'll go on both sides, and I start with the pre-auricular, and then I go to the post-auricular, and then you see the occipital. You can just march it with your fingers. You want to march with your fingers. And then you have your tonsillar, and then submandibular. And then you now look at your cervical. You have anterior cervical, and then you have post cervical. And then you have that deep cervical. So here's your superficial, there's your deep, there's your posterior. So you know that the anterior will be in, just right here in this area. And then you have your supraclavicular. Think about your clavicles, supra, above the clavicle. And then you have your infraclavicular, which is going to be under the clavicle. Check out the submental. All right, now shoulders. Ask the patient, once you finish checking the lymph nodes, ask the patient to reach the arm above the head, touch opposite shoulder, over and under. All right, ask the patient to reach, and then you can kind of just tell your patient to just, shrug the shoulders. All right, cranial nerve is just cranial nerve 11, shrug the shoulders against resistance. So that will give you an idea that cranial nerve 11 is intact. And it's a big deal, especially if you're going to be working with stroke patients. Upper extremity and brachial and ulnar pulses. So upper extremities, now I have my patient flex or extend their arms. I'm going to check for the brachial pulse and the ulnar pulse. All right. Have the patient to sit up. Skin, you're going to look for the skin texture, hair distribution, temperature with the back of the hand, moistures, you're looking for lesions, you're looking for abrasions. So you're looking at, while you're doing the poses, you're looking at the skin, checking muscle mass, joints for symmetry, you're looking for tone, and you want to test muscle strength. So ask the patient to flex shoulders, tell them to flex while you resist. Elbows, flex while you kind of give some resistance, and wrists. It will give you an idea if your patient has full range of motion. Should I leave this patient alone? Is this patient going to be able to feed him or herself? Tell the patient to supine. That's with the palms up. And pronation of the forearms. That's with the palms down. Supination, pronation. Supination, pronation. Finger to nose test. All right. It's exactly what it is, guys. Finger, put your finger to your nose. Now touch my finger. Put your finger to your nose. Now touch my finger. And sharp and dull discrimination. So you want to get a broken tongue blade, and you just want to go over the patient's upper extremities. You kind of just want to rub the tongue blade on the patient to see if the patient can feel the tongue blade. If you want it to be sharp, he should say sharp. If sometimes the patient will say left side is sharper than the right side. That's an idea that the patient has some type of residual effects from the stroke on the side that is dull. Cotton balls in various locations. Ask patient if they feel it, because you're testing sensory. All right, if the patient had a stroke, The patient may not be able to feel something on the left side. Now, deep tendon reflex. I want you guys to put this in. Put NCLEX here. Take my word. Trust me on that. NCLEX. Deep tendon reflex. All right. So you have your bicep tendon, you have your brachioradialis, and you have your tricep. So I showed you guys pictures last week. I want you guys to highlight this and put it in red. You have to be able to elicit a reflex in these different positions. The board wants you to elicit deep tendon reflexes because of magnesium sulfate that we give patients. Magnesium sulfate is a muscle relaxer to the extreme. So you have to know how to elicit the reflex. So that's NCLEX. Now you want to look at the hands. You're checking for clubbing, hygiene, and capillary refill. Why? Clubbing is someone who's had years and years and years of respiratory issues. So the clubbing will be evident. Hygiene. Sometimes you want to look under the nails. That's where we carry a lot of bacteria. And capillary refill, I want you to put, it's supposed to be less than 3 seconds. And it gives you an idea how the patient is doing cardiovascular wise. And you always want to test muscle strength. So ask patient to squeeze fingers, gradually increasing strength. So tell them to feel your fingers and gradually increase the strength. Hands, clench and unclench fists. So you tell them, make a fist. Okay, release the fist. Make a fist. All right. So that's also a good indication, range of motion, how well your patient is doing, neurosensory wise. And our absolute favorite, the cardiovascular system. Now, why in the world do I need to learn the cardiovascular system in society, the society that we live in today? Does anyone have any idea why we have to learn about the cardiovascular system in the society that we live in today? What is the number one killer? What disease is the number one killer in the US? It's cardiovascular disease, right? So just think about if you had 5 patients, how many of those patients will be diagnosed with a cardiovascular issue? Hypertension, coronary artery disease. How many? A lot. At least if you had 6, at least 5 or 4. A lot of cardiovascular issues in the adult population. So NCLEX. I'm going to open a cardiovascular lecture for you guys today so you can go and look at it on YouTube. It's a very good lecture. I'll also send you the PowerPoints, okay? I would really take the time and learn that cardiovascular lecture. So what you want to do is the first thing you want to take the bell of the stethoscope to listen to these sites. The bell of the stethoscope is the small. So like I have the big diaphragm on the back, I have the bell. So the bell of the stethoscope to listen to sites. So I want you to write NCLEX and I want you to write drag and drop. So this is where your drag and drop will come in. And guys, this very image is on your NCLEX. It's the exact same image. So NCLEX. I want you to write NCLEX. Okay? NCLEX. So aortic. You have your aortic. You want to listen to the bell first. Yep. And you have your pulmonic. You have your herbs points. You have your tricuspid valve. And then you have your mitral valve. So they have this saying, all physicians take money. All physicians take money. So take a good look at that. All right, some very good points here, okay? Aortic, pulmonic, herbs point, tricuspid, and then the mitral valve, which is the point of maximal impulse. That is your apical pulse. Apical pulse. So this mitral, apical, that's it. That's your big, that's what you'll hear the heart sounds the loudest, the most pronounced. So when your patient is taking digoxin, this is why we use this pulse as nurses. We don't ask the patient to take their own apical pulse, but we do. This is why we go here. It is the point of maximal impulse. So first you listen to the bell, and then you listen with a diaphragm. So it's bell first, and then the diaphragm. Okay. All right. So now we have our respiratory. Respiratory. So you'll ask the patient, have they had any recent procedures, trauma to the chest, palpable anterior chest wall. So you want to palpate first the anterior chest wall. So you're going to palpate. And you're looking for emphysema. You're feeling for like any type of crepitus. So you're palpating first. And then you're going to percuss. Now I get in a lot of trouble for percussion because healthcare providers, nurses don't percuss. But guess what? The board still wants us to know. So I'm just going to go with the board because I want my license. So I'm just going to work in my theoretical world. And I'm going to learn how to percuss because I know that in order for me to get my license, I need to percuss. Now, will I ever do this on the floor? Maybe not. But for today, since I need my license, I'm going to percuss. Are you guys with me on that? So how do we percuss? Percuss lung fills anteriorly and posteriorly. So this is how you percuss. And they give you the diagram. That's how you percuss. All right. So you want to auscultate lung fills. Also, auscultate is next. So far we have palpated, we have percussed, and now I'm going to listen. You tell the patient, take a deep breath in, blow it out. You're also looking for like abnormal curvature. This is where the kyphosis and lordosis, this is where you'll find it and document it. All right, the abdomen. Okay, so patient lying in supine position. You'll have the patient to lie on his or her back, expose the xiphoid process to the symphysis pubis. And you're looking at the abdomen. All right. You're looking at is it flat? Is it rounded? Is it protuberant? You're checking for symmetry like lesions, colors, scars, hair distribution. Okay, you're looking at the umbilicus. You're checking for all of these things. Prominent venous patterns. So you're looking at these. If you see these abnormal dilated veins, you have to report that because it could indicate liver disease or portal hypertension. So you want to use a diaphragm to auscultate the bowel sound. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And the bowel tones will be most active in the ileocecal valve. All right, so are the bowel tones, are they hypoactive, normal, or hyperactive? Okay. If it's absent, you have to call the physician right away. You have to listen at every quadrant for 5 minutes and then call the physician and let them know how many quadrants have absent bowel sounds. Use the bell to listen for bruits over the abdominal aorta. You have to use that bell. You're checking for abdominal aortic aneurysms. That's why you use the bell to check. And then you percuss. So first, what did we do first? The first thing we did was for the abdomen. First thing you want to do is inspect. And then you want to auscultate. And then you want to percuss. And then you want to palpate. This is the board question, guys. Put NCLEX. All right, so let's go back up real quick. Look at this. So for respiratory, the first thing that we had to do for respiratory was palpate, percuss, and then we auscultate it. You inspect, palpate, percuss, and then auscultate. That's strange because now they want me to inspect, auscultate, percuss, then palpate. Let's pit them up against each other. IPPA versus IAPP. Inspect, auscultate, percuss, palpate for the abdomen. But when I do the chest, they want me to inspect, palpate, percuss, and then auscultate. Seem like a petty board question to me. So make sure you put NCLEX there. All right, so abdomen. We're also checking for hernias. Patient raise heads off of the pillow, Valsalva maneuver, hold breath and bear down. This increases abdominal pressure and makes hernias visible. So you want to check for hernias. And what is NCLEX? Now, here you go, NCLEX. If patient experiences tenderness upon palpation, rebound test. So this is to determine if a patient has appendicitis. So let's just get right down to it. This is huge on the board, okay? So I want you guys to put this in red. This is very, very important. All right, this section. I'm going to erase it again. And I want you guys to pay very close attention to this because this is the NCLEX now. So when it comes to appendicitis is a NCLEX question. So if patient experiences tenderness upon palpation, if I'll palpate and the patient is experiencing tenderness, gently press over painful area and gradually increasing pressure. And then quick release. When I release, if pressure increases, it's a positive for rebound tenderness. I can call the doctor right away. And that is huge. All right. That's your NCLEX question for the abdomen. You have 2 so far. Are abdomen tones soft? You want to feel, is it firm, distended, or if it's rigid? Rigid. If you have a rigid, flat, rigid abdomen, rigid, hard, flat abdomen, that's an indication that the patient has some type of abdominal complication. Most likely the appendix ruptured. Now they have a abdomen, they have a rigid abdomen, rigid board-like abdomen. That's an indication of the appendix has ruptured. That is also an NCLEX question. This is the main reason why, guys, when we assess the abdomen, we don't go into the room and start palpating the abdomen. We inspect, we listen, we percuss, and then we palpate, because your patient may have hernia, your patient may have AAA, your patient may have appendicitis. So we don't go into the room and start pushing down on the stomach, on the abdomen. That's a huge safety issue. All right. Then you want to percuss over the costovertebral angles. So that's just like the rib. Like if you go down to the bottom of your ribs, you can feel that angle, that costovertebral angle. And what you're trying to do is basically palpate to see if the patient has an inflamed kidney, nephritis. All right, guys, we're almost there. Lower extremity. You want to test the pedal, you want to test the pulses. So there's a femoral pulse. I want you to, that's NCLEX, put NCLEX. Okay, remember, guys, I had 3 students this week pass the NCLEX, so FYI. Femoral, that's NCLEX. Femoral is the pulse, that's your go-to pulse for emergencies. It's strong pulse. Okay, then you have your popliteal pulse, you have your posterior tibial pulse, dorsalis pedis pulse. So all of these guys can be drag and drops. NCLEX, okay, especially that femoral pulse. All right, so you want to observe for onychomycosis, which is toe fungus for the lower extremities. You want the patient to be able to, you're checking the range of motion. And most importantly, can this patient ambulate? Now I'm taking my tongue blade. I'm going down the legs because I'm testing for sharp, dull discrimination. Now let's talk about sharp, dull discrimination. Can we talk for 1 second about this, about the lower legs? So if you are only taking the NCLEX, all right, taking the NCLEX or taking the exit, and you have a patient who had a right side stroke, right? Where would you expect the dullness? On the left side. Am I right? Now, I know this doesn't happen all the time. Sometimes patients have no residual effects from a stroke. Seen it myself. No residual effects. But sometimes they do. So if they have a right side stroke, you guys with me? Right side stroke. And I take this sharp piece of my tongue blade and I go up and down this patient leg, and he says, "Oh, I feel it's dull on my left side." Is that expected since this patient has been diagnosed with the right-sided stroke? So if I have a right-sided stroke, I'm going to see the effects on my what? My left side. If I take a needle like a safety pin and I stick you with the safety pin on your left side and you've had a right-sided stroke and you say, "I feel it's kind of dull." Is that expected? Yes. If the patient has been diagnosed with a right-sided stroke, expect for that left side to have the residual effects. All right. So sharp, dull discrimination, that's NCLEX, but they're going to give you a patient who has a right hemisphere stroke or a left hemisphere stroke. Okay. Tap cotton balls in various locations. If patient if they can feel it, you want to do the vibration test with a tuning fork. Place hand of tuning fork on each toe. I would recommend for this one, guys, for the tuning fork, just in case you do get it, look at a video, like look at it twice. You'll never forget it. Okay. Patella reflexes. This is the one that we're very familiar with because they flat patellar end on the percussion hammer. So we all know about when the doctor hits our patella and elicits our patella reflexes. But again, the NCLEX wants you to be able to elicit reflexes. So I'm going to put NCLEX here. Take it from me. Trust me on this. NCLEX. You have to know how to elicit reflexes. And heel to shin test. So you want to slide heel a foot slide the heel of the foot from the ankle to the knee in a straight line. And you want to repeat on both sides. This will give you an indication of where the weakness comes from. And that is that. So that is your head to toe assessment. Why am I stressing you about head to toe assessment and we're doing health promotion and maintenance? Well, the reason why I'm stressing you out is because I want to show you something. I'm still here, guys. I'm just pulling it up. I'm still here. And by the way, guys, Trust Bridge is having a hiring event. Trust Bridge is having a hiring event. And I want to show you guys before we leave a very good place where when you guys get your license, where you can go and you will have an interview and a job within, I was hired within not even 1 week, I was hired with this company. Okay, so I'll give you guys that. All right. All right, so why am I stressing out about the head to toe assessment? Okay, so when I go to my test plan, which is my guide to learning for the NCLEX, because I'm not going to pay somebody $1,000 to teach me something that is already here. This is public record for all of us. So this portion that you and I conquered today, we mastered, is perform comprehensive health assessment. You see that? Comprehensive health assessment. I want you guys to also fill out and complete the nutrition. I'm going to send you the diets, the different types of diets that you have to know. All right. I also want you guys to, I'm going to send you the worksheet again. So I want you guys to start mastering this, providing care for patients between the ages from infancy to the ages of 65 years of age. Okay. So this is what you guys are going to work on today. You're going to work on your comprehensive health, your nutrition, and you're going to conquer this monster. All right. I want you to start looking at the age group developmental worksheet that I send you. I'm going to send you some more exercises that break it down even further. And that way, since this is like a real huge piece of the pie, I want you guys to master that. And you'll notice here, this right here is going to be easy for you guys to assess clients' readiness to learn. I know you guys got that. All right. This will help you assess, educate clients about how health risk. I know you guys understand that, diabetes, hypertension. And then we're going to hit prenatal. Eventually, we're going to get to prenatal care. Plan and participate in community health education. Those are the triage. We did that with management of care. Educate client about preventative health care and maintenance. You're going to get a flyer on that. Provide resources to minimize communication barriers. I know you guys know about the interpreter line. You guys understand that every patient gets the information in their native language. The targeted screenings, I want you guys to focus on your nutrition, especially for our infants, toddlers, school age. All right. And when it comes to these prevention and treatment of high risk health behaviors, you guys know that's going to be sexual transmitted infections and hypertension and diabetes and hyperlipidemia. All right. And look at this. Assess clients' ability to manage care in home environment. That is making sure that we don't have any throw rugs, that the patient is able to perform ADLs, that they know about those carbon monoxide monitors, that they know to put the poison control number by the phone. All right. So how do you guys feel about this help? How do you guys feel about this section thus far? What are your thoughts about health promotion and maintenance? Are you over it already? I know I am. Now, if you want to It's a lot to refresh. That's the truth. But if you break it down the way that I'm going to break it down for you guys, like if you look at those worksheets now, you'll see, okay, I got to learn this, this, and just put it in your pocket and just embrace it for an entire week. And remember, if you go onto Saunders, if you learn through questions, go on Saunders and knock those questions out in Saunders also. There's a whole lecture on health promotion and maintenance in Saunders. Just straight Saunders questions that will guide you. They'll let you know, hey, they're going to ask you this, they're going to ask you this, they're going to ask you this. So if you learn through questions, use the Saunders health promotion and maintenance. All right, guys. Wish me luck. I'm headed to the hospital tonight. So, but I will see you guys tomorrow at 2:30. Okay, guys. See you later.